7 warning signs of a stroke you should never ignore after 50. Have you ever wondered if your body could be sending you warning signs before a stroke? Many people over 50 experience symptoms that seem harmless at first, only to discover later that they were actually warning signs of a stroke. The scary part is that every minute counts. The faster a stroke is recognized and treated, the greater the chance of recovery. Before we begin, make sure you hit the like button, subscribe, and turn on notifications so you never miss important health information that could save a life. Let's look at the 7 warning signs of a stroke you should never ignore. 1. Sudden weakness or numbness on one side of the body. One of the most common stroke symptoms is sudden weakness or numbness in the face, arm, or leg, especially on one side of the body. You may notice that one arm feels heavy or one side of your face droops when you smile. If this happens suddenly, seek emergency medical attention immediately. 2. Difficulty speaking or understanding speech. Have you ever tried to speak, but the words came out slurred or confusing? A stroke can affect the parts of the brain responsible for language. A person may struggle to find the right words, speak clearly, or understand what others are saying. Even if the symptom lasts only a few minutes, don't ignore it. 3. Sudden vision problems. A stroke can affect eyesight in one or both eyes. You may experience blurred vision, double vision, partial loss of sight, temporary blindness. Many people assume it's just eye strain, but sudden vision changes can be a medical emergency. 4. Severe headache with no known cause. A sudden, intense headache that feels different from your usual headaches may be a warning sign. Some people describe it as the worst headache of their lives. If a severe headache appears suddenly, especially along with other symptoms, seek medical help immediately. 5. Dizziness and loss of balance. Do you suddenly feel dizzy, unsteady, or unable to walk properly? A stroke can affect the brain's control of balance and coordination. If you suddenly lose balance, stumble, or feel as though the room is spinning, don't dismiss it as normal aging. Take it seriously. If you're finding this information helpful, take a moment to like this video and share it with family and friends. You never know whose life you might help save. 6. Confusion or trouble thinking clearly. A stroke can suddenly make a person feel confused or disoriented. They may forget familiar names, have trouble concentrating, become unusually confused. Family members are often the first to notice these changes. Any sudden mental confusion should be evaluated by a healthcare professional right away. 7. Facial drooping. This is one of the easiest signs to recognize. Ask the person to smile. If one side of the face droops or appears uneven, it could indicate a stroke. This symptom is so important that it is part of the famous FAST stroke test. Remember FAST. F. Face drooping. Arm weakness. S. Speech difficulty. T. Time to call emergency services immediately. The sooner treatment begins, the better the chances of preventing permanent damage. Final thoughts. Stroke is one of the leading causes of disability and death worldwide, but recognizing the warning signs early can save lives. Never ignore sudden weakness, speech problems, vision changes, severe headaches, dizziness, confusion, facial drooping. Your body often gives warning signs. Listen to them. If you learned something valuable today, please like, share, and subscribe to this channel for more health tips designed especially for adults over 50. Thank you for watching, stay healthy, and I'll see you in the next video.